PPI, or public and patient involvement, forms an integral part of health and social care research. It refers to the involvement of the public, patients, and their families and carers, not just as passive bystanders or research subjects, but as active co-contributors to the research process. It can improve research quality, relevance, and impact. This short video explains our PPI Planning Tool. This is a tool developed to assist researchers to plan out and think through how and where they can involve the public or patients in their research. From inception of deciding on the most relevant research question, through all stages of the research cycle, to dissemination and close of project. By using the tool, the researcher is encouraged to write a comprehensive and well thought out PPI section to demonstrate real and meaningful involvement of the public and/or patients. You can download the PPI tool and print it out, and fill it in using post-its. These allow you to be flexible with your ideas and thoughts and move them around. Or you can complete the planning tool online, collaboratively, in an interactive session with a PPI expert. Just drop us an email to arrange. The PPI Planning Tool allows researchers to plan the involvement they will have with the public and patients during their research project. The boxes can be completed in a sequential order, and then the PPI section can be written once finished. The PPI section will need to be aligned with your specific funder's requirements. For example, what is the word count, and does the section have to be written in plain English? So let's start off with what. What is the research question? What key problems need to be addressed? Have they been identified in dialogue with community stakeholders for whom the research is most relevant? Here we need to ensure that we are asking the most meaningful and relevant research question. The next step is how, or our response. How does your research plan respond to the research question? Have the public or patients been involved in this process as consultants, advisors, or co-researchers? Here you can explain what methods you're going to use to collect your data. Are your methods accessible and practical for involvement by the PPI representatives? For example, how will those with a disability or hearing loss be accommodated? Next is who. Who are you going to engage with and why? The general public? Patients? Will you need a specific disease subset? Carers? Family members? Describe how you will engage with the relevant people. Will patient organisations be used or social media platforms? How many people will be involved and for how long? Here you can really show that you've thought about the public and patients that you want to involve in your study and how you're going to engage with them. Next, research stages. Here we show how the public and patients will be involved in specific stages of the research cycle from inception to close of project. This is the most important section and should take the most time to complete. Here we need to demonstrate meaningful and active involvement of PPI representatives in as many aspects of the following as appropriate for your specific research project. Firstly, design. We have already touched on how the public or patients should be involved in identifying what is the most important and relevant research question. How PPI representatives will be involved in designing and managing the research study is equally important. For example, by giving guidance on ethics, methodologies, or recruitment approaches. PPI representation on steering committees can ensure that the research project is carried out in a transparent and accountable manner. Secondly, conduct or doing the research. PPI partners may be involved as lay interviewers or in data collection, for example. Thirdly, analysis and interpretation. Members of the public and patients can also be involved in the analysis of results. They can also assist in interpreting the results in a relevant and meaningful way. Finally, dissemination and implementation of research findings through newsletters or invited presentations in accessible language. PPI representation can also ensure that the research findings are implemented and translated into real life in the most impactful way possible. Next is involvement. What level of involvement or control will the public or patients have from beginning to the end of the process? Are the roles and responsibilities clearly defined and agreed in advance? Next is support. What PPI supports or resources are available to you at UCD? For example, in some instances, training may be required for researchers to allow for maximum benefit. Next, we move to budget. Here we detail the costs and expenses to support PPI activities. Here you can link in with the UCD PPI cost calculator, which you can find on our website. PPI representatives should have costs covered for their participation, and these must be factored into the budget. Lastly, we need to outline value and impact. What values and impact will your study bring to your target patient population and/or the public? Here we need to really emphasise how our outcomes are going to be impactful for the relevant stakeholders for whom the research has been undertaken with. To learn more, please visit our website at ucd.ie/public engagement/resources. You can also contact us by email at ppi@ucd.ie.